Welcome back. We are committed to you here at Fox Carolina, and DHEC says COVID cases in South Carolina are at the highest they've been in a while and are continuing to rise. The agency issuing a warning during their public health briefing today. We saw 714 new cases reported today alone, along with 10 deaths in South Carolina. That's the highest number since mid-April. Officials talked about the more contagious, more dangerous Delta variant, and even a few new variants that are starting to make their way into the U.S.
All this happening as doctors say they are trying to combat vaccine misinformation at every turn. Fox Carolina's Matt Koufax live in studio for us tonight with the story.
Yeah, good evening, guys. We wanted to follow up on the issue of vaccine misinformation and ask medical professionals what could potentially happen here if vaccine pace continues to be relatively stagnant and variants continue to be allowed to spread. One doctor I spoke with did not hold back, telling me he is starting to get exasperated with the whole situation.
Dr. Helmut Albrecht says there's been a disturbing shift in hospitals across the Palmetto State lately and that COVID variants like Delta are to blame.
Most commonly affected age group is now under 35.
In fact, he says the average age of a person they now hospitalize is in their 30s. The average age of their last several deaths has been in the 40s.
I feel like the vaccines probably are very effective for that variant also. I'm not too concerned about it.
Albrecht says people like Dora Edwards who are vaccinated are right to feel safe, but
Delta is really taken over, and it's clearly taken over more counties, states, populations that are unvaccinated.
He says vaccine hesitancy and a storm of misinformation are to blame. So we asked him to give us the facts.
Everyone we've hospitalized and everyone who is trying to die on us or is dying or is dead in the last couple of weeks has been unvaccinated.
And he says it's frustrating because it's all preventable.
It's getting old, in all honesty. It's one of the safest, one of the most effective vaccines we've ever seen. The difference is 33% after one shot, over 88% against symptomatic infection after the second shot.
In other states like Missouri, where vaccination rates are similar and where Delta makes up around 70% of the cases, he says they're seeing infections surge to levels that are about half of what they were after last Christmas.
Obviously, he says that could be bad if South Carolina gets to that point, adding that Albrecht says he's worried about the start of school for next year. He says it's inevitable that many families get exposed to variants when unvaccinated kids get together in buildings where virtually all restrictions have been lifted. Guys, back to you.